All right. Thank you so much for joining us today for this really exciting webinar on lymphedema and fibrosis compression treatment for the breast and torso. This is very exciting to me because I love working with Waries, and this presentation is going to talk not only about fibrosis, but quite a bit about Waries solutions for fibrosis. My name is Karina Ashforth, and I've been a lymphedema therapist for over 20 years, and I am excited to be presenting this material today. I would like to let everyone know, both those who are watching live and those who are going to see the recorded video of this, that there are two special discount codes that you can use for watching this webinar. And the first one is the top code WEAR24, and that will get you 35% off the LANA exam. And the next code, NEWGRAD, NEWGRAD, can get you 50% off the LANA exam, but there's some requirements of being a CLT graduate. You need to meet the LANA eligibility requirements, and most importantly, sign up within 3 months of completing your CLT training. So before we start, I'd like to go through the course objectives, because some of you may already be aware of the impact of fibrosis on lymphedema, but for others, this will be new information. I feel that awareness and treatment are critical components of lymphedema care, and treating fibrosis is an important way to influence lymphedema progression and make huge changes in the quality of patients' lives. Following this course, participants are going to be able to have knowledge of fibrosis types common to breast cancer-related lymphedema, compression options for truncal and breast lymphedema, and fibrosis treatment options for truncal and breast lymphedema. Here's our agenda. First and foremost, I'm going to ask, please don't take any screenshots or pictures of the images here, because these are patients who gave their permission specifically for this presentation, and we don't want to share their images freely. Now, we're going to talk about breast cancer-related lymphedema and what it is, lymphedema staging and fibrosis progression, common types of breast cancer-related fibrosis, overview of lymphedema and fibrosis treatment, compression for swelling and fibrosis, and Waries antifibrotic compression for the breast and the torso. So quick review. Lymphedema is basically excess interstitial fluid that can be caused by many different things, which creates swelling. And it's considered chronic if swelling is present for over 3 months, and that's when we usually call it lymphedema. To talk about breast cancer-related lymphedema, it's important to know that it's the #1 cause of upper body lymphedema in the Western world, and that people who have had breast cancer have a lifetime risk for lymphedema in any of these parts, in the arms, the hands, torso, breast, axilla, and this is because of a damaged lymphatic system. This can be caused by a number of factors. There can be surgery, which can include a mastectomy, a lumpectomy, sentinel node or axillary node biopsies. I was shocked when I found out that either adjuvant or neoadjuvant chemotherapy can cause lymphedema depending upon the chemo drug. Taxane-based drugs do have lymphedema as a known side effect. Radiation therapy also causes damage to the body, which can create havoc with the lymphatic system and cause lymphedema. And lastly, reconstructive surgery is an option that many women like to take because it makes them feel whole again, but it can actually create more scarring. And if a woman develops lymphedema after reconstructive surgery, then it definitely needs to be treated. talk about the stages of lymphedema, because this is very important for lymphedema treatment as well as fibrosis. Here's a visual of what the 4 stages of lymphedema look like from stages 0 to stage 3. I'm going to show this picture again after we talk about the stages, but just get this in your mind. Stage 0 is the latency stage where there is no apparent edema. You can't feel it, you can't see it. You can test it with bioimpedance, but it's basically dormant, not super active at that point. Stage 1 is the lymphedema stage that is usually pitting. You can see and feel the swelling, and when you elevate the swollen part, the swelling can go away. Stage 2 is called spontaneously irreversible, because this is the stage where you can reduce partly, but you can never completely bring that body part down to its original size. And stage 3, known as elephantiasis, is very severe. Now, see on the right how it talks about the different amounts of swelling, but this next slide shows that there are actually a lot of other factors going on in staging. Fibrosis is actually used to stage lymphedema. And so in the latent stage where you can't see any lymphedema or feel it, you already have fibrosclerotic tissue changes occurring. In stage 1, they continue, and in stage 2, they become extensive. And at that point, the body starts to form adipose or fat deposits. This is why it's not reversible completely, because some of the volume of that body part is due to excess fat. And then in stage 3, my goodness, we've got more fibrosclerosis, we've got more adipose, as well as skin changes. So let's go back to the pictures that I just showed you, and you can see visually how stages 2 and 3 are always going to be larger because of the fat deposits from the lymphostatic fibrosis. So let's talk about fibrosis. What is it? Fibrosis is when tissues are damaged and they become hard, thick, dense, and the healthy tissues are replaced by either hard collagen or soft fat. We're going to talk about some specific examples of fibrosis, but the hard fibrosis that is most commonly would be scar tissue from surgery or trauma, or radiated tissue. And the soft fatty fibrosis is commonly seen in the lymphostatic fibrosis, which we're going to talk a lot about in just a minute, and then the SAT, which is found in lipedema. I have a news flash for you. All lymphedema patients have fibrosis of at least one type. So what can we do to help that? We're going to learn more in a minute, but let's go through a little bit more about fibrosis. When you're documenting as a therapist what is happening with the patient's tissues, you might find this helpful. These are some tissue descriptions that Robin Bjork wrote about in the STRIDE algorithm for compression therapy. STRIDE stands for shape, refill, issues, dosage, and etiology. And a lot of tissue that is very swollen, but not super fibrotic, would be called watery. That's where there's maybe soft pitting. It's really easy to reduce. There's often a negative stemmer sign, sometimes positive because of the swelling, but this is generally stage 1. Fatty tissue can be either healthy fat, which we all have, or it can be the lipedema SAT, which I talked about, or lymphostatic fibrosis, which is a form of fatty fibrosis. Tissue that's like putty is soft, and there's pitting if you press long enough. This is where we're getting early fibrosis, there's usually a positive Stemmer's sign, and this is usually stage 2. Woody tissue is hard, non-pitting, extensive hard fibrosis, and a positive Stemmer's sign, and this can be either stage 2 or 3. Let's talk about some common types of upper body fibrosis. The top 3 you can actually see in the picture of this patient right here. And these are the 3 most common types of fibrosis that I see clinically with my lymphedema patients, and you probably do too. So the first one is the lymphostatic fibrosis. Second is surgical or traumatic scarring, and you can see she's got a whopping scar there. The third is radiation-induced fibrosis, and you can see the hyperpigmentation that has been a side effect of her recent radiation therapy. Additionally, we can sometimes see cording, fibrosis from seromas or fat necrosis or wounds or even cellulitis infections, but I won't go into detail about those. That's for another talk. Let's talk about lymphostatic fibrosis, though, because this is present in all stages, all types of lymphedema. It's an inflammatory process. So we know that lymphostasis is a high-protein extracellular matrix that creates adipogenesis, which basically is creating a permanent fatty matrix. This is what we see in stages 2 and 3 of lymphedema, and it is irreversible. It also contributes to a vicious cycle where patients can acquire more and more fibrosis. So you can see in the illustration of this patient, her right arm is way bigger than her left arm. And some of this is due to swelling, but some of this is due to the fatty fibrosis. Another way to look at it is through the work of Dr. Håkan Brorson, who pioneered surgical liposuction as treatment for lymphedema. And he shared this picture and this reference with me. I want to thank him for that. And you can see in the top picture versus the bottom picture, this is a before and after from the liposuction. So what we see is that the subcutaneous adipose tissue that's actually extracted contains 90 to 100% adipose tissue in the aspirate. And my patients are horrified when they realize that they are acquiring fat tissue because of lymphedema and that it snowballs. But there are some ways to stop this progression. When we talk about lymphedema treatment, we want to start by talking about the core treatment, which is the complex decongestive treatment. And then there are also adjunctive treatments, which we use regularly in our clinic, which can include patient education, pneumatic compression, and antifibrotic treatment. So just to recap CDT, we have generally 4 components, which include the manual lymphatic drainage, compression, exercise, and skin care. I want to talk for just a minute about manual lymphatic drainage, or MLD. It is a light massage that's performed in the direction of lymph flow to stimulate lymphatic circulation. It decongests and reduces swelling and moves the congested fluid in the damaged areas so that it can be uptaken at the intact lymph nodes, but it does not treat fibrosis. It's possible to incorporate antifibrotic manual and instrument techniques along with MLD, but it's very important to know that CDT is not designed to treat fibrosis. It is designed to decongest. So that's why fibrosis treatment is a really, really important thing to be aware of, because many schools really don't talk about it very much, but yet it's right at the root of our lymphedema staging. When we talk about the types of fibrosis treatment, we can look at root causes that influence inflammation in the body. and look at ways of reducing those risks. There are many manual therapy techniques, and there are many types of modalities. And I wish I could talk about all of these. I am passionate about all of these, but we're going to focus today on antifibrotic compression garments. And we're going to talk just very briefly about pneumatic compression because it enhances the performance of the antifibrotic compression garments. So antifibrotic compression basically is like regular compression, but it's got a component to it that can assist in remodeling fibrosis. When we look at our basic compression goals, we want to prevent refill. And so to do that, we use short stretch bandages and compression garments. The types of compression garments used can be elastic, inelastic, such as Velcro wraps, and quilted. I'm here to tell you that it is a missed opportunity if you are using compression with your patients and you don't address fibrosis, because there are so many options for compression that also treat fibrosis. And the key is a textured component. So with the elastic compression garments, the textured component is found in the weave, as you can see in this example. You can have custom flat knit garments. And then this example actually gives you an anti-cellulite elastic garment, as well as specific antifibrotic elastic garments for lymphedema. And then I'm here to tell you that you can make any elastic compression antifibrotic if you use quilted compression pads or garments underneath. Next, I want to talk about bandaging and Velcro wraps, which in and of themselves are not antifibrotic, but you can use pads or garments underneath. And this is an example of a custom entire pit pack arm sleeve with a Velcro wrap over it. And this has a very tremendous aggressive compressive technique as well as antifibrotic technique. When we talk about the types of quilted compression, by definition, it's antifibrotic, and there's usually two components. It can be either chipped foam or cherry pits, and they can be custom garments or ready-made. They all have antifibrotic micromassage effects, but the thickness can vary from a mini pad thickness to several inches. And the bulky garments are great. They tend to be used more at nighttime because they are so bulky. But remember the principles of bandaging. Bulk is going to give you better compression. And in many cases, it can give you a better antifibrotic effect. So I use the bulky garments as my big guns and use them at nighttime. And then during the daytime, we go for something lower profile like the elastic. The other nice thing about chipped foam is that it's very easy on frail skin. And just a word about cherry pits. If you haven't ever heard of them before, I included a reference to a study I did over 10 years ago where I took cherry pits and made little bean bags, and we used them as a prosthetic in the bras of women that had had lumpectomy surgeries. And we found all kinds of wonderful effects with them. But you need to be very careful because they are very aggressive, and you don't want to use them on skin that is not intact or that is frail. So the quilted compression relies on an external compression. I'll talk about that more in a minute. And the other thing that's very interesting, especially with the quilted and sometimes with the elastic, is that you will see little indents in the skin that indicate an impact on swelling. This next slide is a slide of my thigh. On the left, you can see my thigh before bandaging. Afterwards, on the right, I used a pit pack and bandages for about 20 minutes. And look at all that pitting. I did not break down fibrosis in 20 minutes, not with this modality. But over time, there is the potential to remodel fibrosis. But I want to just make it very clear that when we see indents like this, after wearing a antifibrotic micromassage garment, it doesn't necessarily mean that, wow, it's changed the fibrosis already. No, it's impacted the swelling already. And if we keep impacting the swelling and keep getting down to that fibrotic layer, it's like the action of water on a stone. It just keeps dripping away on it until it gets softer and more flexible. So what's important to remember about compression is that the more compression you use, the more of an antifibrotic effect you will have. So on the left, the elastic custom flat knit is going to be effective, but it's not going to be as much compression or bulk as the Velcro wrap, which is way more aggressive, and bandaging, which is even more aggressive. And then the pump has a huge impact over any type of compression. I love using pumps and quilted compression, especially because my patients are getting a double massage. So when we talk about using pneumatic compression over textured compression, it's important to remember that pumps decongest swelling, but they can also amplify the antifibrotic effects of the textured garments. However, pressure should always be titrated to patient comfort. Thicker tissues are likely going to require more pressure, and tissues can be thicker either because of fibrosis or body mass or both. And if a patient starts to lose either or both of those, you might have to titrate the pressure back down again. Another thing to keep in mind is that all pumps are not created equal. An example of this is a pump that has a specific dedicated axilla chamber that is particularly useful for cording, as well as stimulating the damaged lymph nodes so that the decongestive effects can be more effective. For maximum effects, however, I like to encourage my patients to do a decongestive exercise while wearing their antifibrotic compression. And this can be as simple as diaphragmatic breathing. If you keep in mind that the lymphatic system does not have a central pump like the heart, it relies on the intrinsic and the extrinsic muscle contraction. So the intrinsic muscle contraction would be the little tiny muscles in the lymph channels themselves, and then extrinsic muscles are our skeletal muscles that create a compressive pumping effect as we are wearing our compression. All right, now we're going to get down to the nitty-gritty here and talk about Waries and their revolutionary antifibrotic compression garments for the breast and the torso. I want to say just a little word about Waries because I've been working with Waries products for many years. And what I love about Waries is that they are cutting edge, that they have created solutions where there were none, and they have broken a lot of ground. And they've done it again with this whole antifibrotic move. Nobody else has these products. So we're going to start by looking at the combination of elastic compression with quilted chip foam pads. And this Andrea compression shirt is creating compression on the torso, the breast, the back, the axilla, the upper arms. And what's nice about it is that it has the axilla pads sewn in so they will not migrate. There are options. You can get it without pads altogether, or pads on both sides, or just one side. And this does not come with prosthetic pockets. So that's important to keep in mind. If you have a mastectomy patient, this is really better for bilateral mastectomy or a lumpectomy patient. But this was a groundbreaking product that really brought a new level of antifibrotic treatment to people for daytime use. The KDT is a unique compression t-shirt that treats the thorax and the axilla. But look, it's got a pocket right in the axilla that you can use with a removable quilted pad. So unlike the Andrea shirt, the KDT has the option of wearing it with or without the quilted pad. And the quilted pad is sold separately from the shirt. It's made by LNR, and I'm really, really honored that I was able to be part of the research and development of this because I feel like this has some wonderful applications. Women can wear the shirt during the daytime with or without the pad. Without is a lower profile, and then at nighttime they can put that pad in, and it really gives a nice prolonged antifibrotic treatment to the axilla, the upper arm, and the lateral thorax. This garment does not have prosthetic pockets, but it does have this wonderful axilla pocket that I've never seen before. This is just an amazing invention. This shows how LNR, and they, by the way, created Swell spots as part of their Solaris collection. And these are professionally designed edema and fibrosis pads that are available in a wide range of different shapes and sizes that tuck into compression garments or under compression bandaging. And you can see how they pair very nicely with Waries garments, whether it's a t-shirt or a camisole or a bra. There's really a lot of different ways to use these swell spots. And I'd like to just curate that on the left, we see the curved pad, which is really, really great for catching a couple of scars or a curved scar in just a small area. The breast pad in the middle covers the entire breast area and is great for post-lumpectomy patients. And then the swell spots, which are their circular pad, which works great for either lumpectomy or mastectomies. And we have a few others. Here we've got on the left the kidney pad, which is great if you've got drain scars. And I don't know why, but the drain scars are so much more painful for a lot of people. And this is great for helping to soften and help those drain scars heal, as well as helping with axilla scarring, where maybe there was a axillary lymph node dissection. You can turn it all sorts of different directions and mix and match and use it on lumpectomy or mastectomy scars even. In the middle, you see the lateral pad, which is being shown to help with swelling that is on the top of the shoulder. But because of the rectangular shape, it can work very nicely with post-mastectomy scars. And then you can see on the right the full bra pad, which is giving you a little bit more coverage there. So I really love that Waries approached LNR and put together this collection that you can order from Waries as a two-component, or you can order the components separately, but there's so many options. Also, I wanted to highlight the Waries antifibrotic sternum and genital pad. So as the name says, you can use it for a lot of different things. And using it on the sternum, one of my colleagues, I just spoke with her this week, and she said, I think that every woman who has surgery needs one of these because it's so cushy and it really helps to do a lot of things. It can stimulate the parasternal lymph nodes. You can see those channels directing the fluid towards the axilla. And it can be placed, as you see, in the center of the chest, but you can also put it other places. You can put it under the armpit or on the breast, and it really is a nice bulky but effective pad. We're going to switch gears now because we've been talking a lot about pads. Now we're going to talk about the latest Waries product, which is the Karina bra. And I'm so proud to say that I helped assist in the design of this. And here's how this bra got created. I was giving a presentation about fibrosis, and the Waries founder, Phyllis Keefe, was sitting in the audience. And she was looking at my slide presentation, and I was showing how I created a new bra by taking a regular post-surgical bra and sewing in a liner that was antifibrotic. Basically, I took an antifibrotic thoracic garment and cannibalized it because my patient really needed to have some really good antifibrotic action on her breasts and under her axilla. On the left, you can see what the garment looks like when it's on. And on the right, you can see those little ripples. That's the inside of the garment. We've turned it inside out so that you can see that this textured micromassage fabric gives amazing thoracic and axilla compression. This garment also has chest pockets. You can put in prosthetics, but it does include bust cups. And it's nice to see that the straps are adjustable. There's a zipper front, which makes it easy to don and doff. And we're seeing some amazing results in terms of pain, swelling, helping new scars to heal with a smoother appearance, but it also helps older scars. So this is something that I encourage you to check out because it's been really getting a lot of rave reviews. Let's talk about the effects. So this is a patient who had reconstructive surgery, and you can see the ripples on her skin after she takes the bra off, and how this is really helping to accelerate the healing of her reconstructed breast, how this is really impacting the scar tissue and influencing it to heal faster, softer, with less visible scarring. And she's really a very happy camper. When we look at the back, you can see how much area this covers. Patients are raving about how comfortable it is and the area that it covers. It gives great compression without binding, and it's so easy to put on and take off. But more than that, patients are reporting decreased pain, decreased swelling, decreased tissue hardness, improved skin texture, and improved scar and skin appearance. These are some before and after pictures of patients who have only been wearing the Karina bra a short time, some of them only a week. And you can see a difference in the coloration, in the swelling. This patient says, it's amazing. I have had fibrosis that's worsened in the last 3 years on the left breast. And after a short time of wearing, symptoms are reducing. This next patient is using this after stage 1 of expander reconstruction, and you can see how her scars are looking more even. They're looking less raised. Her breasts are looking more like normal breasts. And she says that having the tool of antifibrosis along with compression is the perfect mix. This last patient, I want to turn your attention to her right nipple because it's very clear that you can see better definition. There's less swelling. The scar is looking better. And this is something that is helping this patient heal after her lumpectomy surgery. So to conclude, I want to just say that I am so thrilled to be working with Phyllis and Waries on their products and helping to give them advice and test subjects and really observing what the effects are, because I feel like this is right in line with fulfilling the goals that I have for my patients in terms of being able to remodel their fibrosis. So I'm going to take questions, but before I do that, I want to just flash this up on the screen for a minute, the discount codes, because this is something that can really be helpful for those of you who want to take the LANA exam, whether you are a brand new graduate or whether you've been practicing for a while and are ready to take it. Do take advantage of these codes to get a discount. So I'm happy to take questions, and I don't know if we have any questions in the chat yet, or any of the questions. Looks like we've got some Q&A. So, oh, this is a very good question from Susan. Can the Karina be worn all day, even though it's suggested to be billed as a night garment? Thank you for that question. So I have women that are wearing it day and night because it is so comfortable. And I feel that it has a very good application during daytime because it is lower profile and it's easy to wear. So I would recommend that women wear it whenever they want to, as much as they want to. But as with any new piece of equipment, I would start by wearing it for maybe a half hour or an hour, and then take it off, take a look at the skin, make sure there's no irritation, make sure the body's happy, and then wear it some more. I would not recommend wearing it all night until it's been successful all day, because anytime I recommend a night garment, I want the patients to be able to wear it during the day so that we can really see, okay, what are the effects after a couple of hours? You know, is it still feeling good? Maybe the patient needs to build up a little bit of tolerance to see if it's appropriate to wear at night yet. And that's another thing I'd like to say, is that patients who have just had surgery might want to wait a few weeks before using the Karina bra, because it's more aggressive than your average post-surgical bra. And it's something where you will want to, first off, in terms of surgical fibrosis, you don't even start creating scar tissue until 3 weeks post-surgery or post-trauma. Scars just don't form before then. So, but then after that point, then we start to gradually get more of a formation of a scar, and it can take up to 2 years to fully mature. So I would say anywhere from a few weeks to a month or two after surgery is a great time to introduce the Karina bra. And this can have great effects, even with patients who are years post-surgery. So I'm really glad you brought up the day versus nighttime, because that led me to the whole issue of when to wear it and what to do before as you're deciding how much to wear it. So another question is, how soon should compression bras be worn after breast conserving surgeries, like a LICAP? And again, it's per patient tolerance, but I would wait a few weeks, because especially if it's like a nipple sparing surgery, the nipples could be a little tender and the antifibrotic fabric might be a little aggressive. So it's really to patient tolerance. And another comment from Anne is, I love my Karina bra. I wish you had made it in a camisole, just 4 to 5 inches longer. And I want to say, Anne, we are already looking at that possibility. We're looking at a bunch of different possibilities. Now that we've discovered this wonderful antifibrotic fabric, sky's the limit. So it does need to go through some research and development, and be patient. But there are a lot of exciting things ahead in terms of possibilities for the Karina bra and other products like it. Shannon asks, does Waries have a similar garment for pelvic swelling? And if you're talking about antifibrotic garments, not yet. Waries has some great garments that are helpful for pelvic swelling that can be paired with the axillogenital pad. And as far as the low profile fabric that you see in the Karina bra, we are looking at some prototypes and playing with that. So that is in the research and development stage. And I don't know, what or when it's going to manifest as, but be assured that Phyllis has all kinds of creative ideas, and we're going to be seeing a lot of really fun things coming out down the road. I don't see any other questions. You're welcome to drop questions in. I'm curious if there might be any questions in the chat. So maybe we can just check the chat. And while we're doing that, I want to just say that if you have any comments or any feedback, let's say that you've tried the Karina bra, Phyllis is always open to hearing your experiences. She loves collecting testimonials. The women whose pictures and comments have been used in this webinar have all given permission, and we really want to hear from real live people, because that's what it's about, is treating real live people. So I'm not seeing, let's see. We've got that light kind of blocking my view of the chat. I don't know if there's anything in the chat that we want to address. Really appreciate the feedback from everyone. Glad that this has been helpful. And you can watch a replay of this on the Waries website. And this is going to be an evergreen LANA presentation. So it will be up on the LANA website. And it's going to take about 2 weeks for it to get up. But tell your friends and colleagues. And if anyone is interested in Phyllis's coupon, it is available still, even if you don't do just this webinar. If you do the LANA webinar or from the Waries website, you can still use the discount codes. So I just really appreciate you guys and your concern for your patients, and that has shown in your attendance of this and other webinars. And I want to thank you so much for coming today. Oh, and there's a few more questions. Let's see. If the patient has trunk seroma, which bra do you recommend? So, Dina, it really depends on where in the trunk. And I typically see seromas on the lateral edge of the breast or even in the axilla, and you want to jump on that seroma, because if that seroma is not treated, it can start to harden. And I sadly had a patient that came to me and her seroma had turned into the density and the hardness of a golf ball. So this is something where the Karina bra, I think, would be a very good choice for a lateral breast or a axilla seroma. And sometimes with seromas, you may want to add a little extra padding. You may want to even add a little extra compression. I have bandaged over seromas and had patients leave the bandage on for several days, because if you can wrap it and leave it compressed, the walls of the seroma will adhere to each other, and then it won't fill up again with fluid. Sometimes you have to get a doctor involved draining it. There's all sorts of different things, different ways. I teach a whole class that goes into different ways to treat seromas. But to answer your question, I think the Karina bra would be fantastic. And let's see. Another question from Catherine is, can you give an idea of price point and if insurance covers the bra? So that's a great question. I don't have the retail price in front of me. That's on the Waries website. However, we do know that this is being billed to insurance. So, and this is actually even a Medicare eligible item. So this is a great way to access your patient's insurance benefits for very effective compression. And if the, let's see, any other questions? I love these questions. I love that people are asking, and I'm just going to give one more minute to see if we have anything else. And otherwise, any follow-up, you can always follow up with Waries. And oh, what code would it bill under? So Phyllis is right here in our studio audience, and I'm going to ask Phyllis for the code.
It can be billed as people are billing it under nighttime and also the daytime compression. I don't have it.
Okay, so Phyllis is telling me that people are billing it both with daytime and nighttime codes. And I don't have those codes in front of me or on the tip of my brain, but you can talk to your vendors, your fitters, and get that information. It is being successfully billed. Great, okay. Well, thank you all so much for your attendance and your attention, and we'll see you at the next conference.